for waiting. We will probably take a much shorter time, but we hope we can cover just a bit of ground tonight. Dr. June and the panel, they invited me to speak on the financial dynamics of dental practice in COVID times, dentistry as a business in the COVID-19 era. And you know, I had to ask her, give me a few days, because anybody asking you to speak about COVID right now, it's like you're like shooting in the dark. You don't actually know. And even at this time, anybody telling you they are an expert.
Thank you all participants for hanging on and waiting. I know it's been a long evening.
Yes.
We are just finalizing these technical difficulties that we're having. Dr. June, Dr. Nick, can you hear us? Can you please?
Yes, I can hear you clearly. Can I go ahead and make the presentation? I had already started giving the presentation. We go ahead.
Okay. Yeah, you can go ahead.
Okay, what I was saying, we apologize for the big hitch and the big delay, and for your indulgence and patience, and for waiting for us. This financial dynamics in dental practice in COVID times, dentistry as a business in the COVID-19 era. Right now, as I have just probably said, anybody telling you they are an expert in COVID in whichever area, oh my goodness, I think they'll be lying, because this thing is changing every day. And not even the scientists, the experts know what's going to happen tomorrow. So initially I was hesitant to get myself involved, but after a few days I said, we are a community and we must share the little that we have tonight. I think somebody has already introduced me. Thank you very much. I think I will go straight to the presentation I have tonight. Most of you, probably they know Dr. Mwangi. I'm the lead dentist at Tender Care Dental. It's along Agwings Kothek Road. That picture there is just the entrance of our practice. When we started a long time ago, we were in Lavington. But now, as you can see, we are probably no longer in Lavington with the proliferation of the slums in names of whatever. There you go, that's our front office desk. By the way, I'm giving this, when I give this information and pictures, especially to the young dentists, basically is to encourage you, especially I'm saying those especially below 40, to encourage you that there's still hope and you can still make it and practice dentistry in a big and in a good way, even in Kenya here. Let's go to the next slide. Okay, that's our reception. I was invited by the pediatric dentists. I'm sure they will be encouraged to see a corner there in our office, specifically reserved for pediatrics. It's called a no technology corner. And I think that's a good thing. Let's go to the next slide. Okay, you cannot practice dentistry alone. It's not a one-man guitar. You really have to have a team, and that is part of the team at Tender Care that helps us in the work. Okay, let's go. Okay, that's the front office staff, the ones who receive you, and basically they manage all of us. We simply go there and work and just go home. It's gone. Okay, that's Dr. Mwangi's office. As of now, I rarely sit there, probably just a few minutes in a day. So I don't know what's, okay, good, let's go on. Okay, let's get into the presentation. This dental practice basically was dealt a devastating blow by COVID-19 come early in the year. And as we all know, we closed our clinics, most of us in fear and panic, because there was very little information on COVID-19. And of course, by the 25th of March, the Ministry of Health ordered all dental practices to be closed. There was massive job losses that followed and ensued. after that. In the US, it was reported in early April that 500,000 jobs were lost in dental practices, according to the American Dental Association report that was given much later on in May. There was no data given in Kenya for the dental industry. We don't have any data given there, but in the whole country, as of end of May, 1.7 million jobs had been lost, and most of them in the informal sector. That was reported by the Federation of Kenya Employers. Okay, let's go to the next slide. Okay, managing business and obligations. We know that COVID-19 caused a healthcare shock that resulted in an economic shock. As you can see there, it was simple, a small virus, which caused a major disruption in the economies of the whole world. These people you see here on the left are in major cities in the America, queuing to register for unemployment benefits. I think they have reached over, I can't remember the numbers now, but it is in the millions of people in that country. So that's what we are really talking about. Okay, as a dentist, now that we are starting to come back, and probably we are not sure of the future, what are some of the areas that we probably need to think about and consider? About bank loans, I'm sure most of us had bank loans. You had mortgages, you had borrowed money from your circle and all that. You may already have done this. Probably this one I should have been giving this sometimes in April, that you needed to request, or you need to request if you haven't done, to your bank for a 4 to 6 months at least moratorium on your principal, interest and other charges. Commercial banks, we know, have already restructured loans totaling 360 billion shillings, according to the Minister for Finance in his budget. Barclays Bank, now ABSA, restructured 50,000 loans totaling 54 billion shillings. And as we can see, individuals and businesses must request in writing and get a confirmation in writing from your bank that the terms that they are giving you. Many people will be faced at the end of this year, next year, with their banks asking for accrued interest because you never got anything in writing. So you must have a paper with you from your bank telling you, or your circle or whatever, telling you exactly what is the position on your borrowing and your loans and all that. Let's go ahead to the next slide. Okay. Rent on premises. You also need to write to your landlord. If you're really in a big tight corner, you need to ask for a rent moratorium for a period your office was closed. You may need to ask for an office rent reduction for 4 to 6 months. And I think we saw what happened to, not Surrey Center, but Village Market. He basically gave rent moratorium, I think, for the rest of the year. Because at this point, no landlord is willing to lose their tenant at the moment. As you can see, those signs there to rent, all those ones are a picture taken in the UK immediately after the Brexit went in 2019. And as it is right now, no tenant, no landlord is willing to lose you as a tenant on account that you don't have money to pay rent. So, but you need to keep it in writing. Okay, let's go to the next one. Dental supplies. Request for longer credit period from your supplier. Negotiate for discounts. At this point, I would say avoid panic buying. Prices will drastically drop in a few months, early next year, due to low demand and oversupply. So do not panic buy. Many suppliers, as you know right now, they have taken advantage of Corona and hiked prices across board of things which sometimes have nothing to do with Corona. For example, last week, I ordered for a bulb for the dental unit from one of the suppliers. And They said 2,000 shillings for the bulb. I drove to Yaya Center, which is an expensive shop there. For the same bulb, 350 shillings. So do not panic buy at this time. Just take it calm and it shall be well. Okay, staff options. What are the staff options which are there? This is a very critical one. Majority of the people, they ask their staff to go on unpaid leave. But you need to be very careful as you write letters to your staff to go on unpaid leave. You need to call them and discuss with them, and they need to verbally accept that they are going to proceed on unpaid leave. Then after that, you write to them and they reply in writing. And that's the only way you can be able to be protected. You can go for salary reduction instead of sending people on leave during the crucial periods and before the income stabilizes. You can declare redundancies for non-essential staff. I think if you had staff whom you thought were not very useful in the practice in the years before or the months before, probably this might be a good time to declare redundancy. But of course, declaring redundancy, you need to pay redundancy fees, which is normally about 15 working days for every year that the staff has worked. In this, I would say consult your lawyer to help you draft any communication so that you protect yourself and your practice from the labor laws violations later in the future. The big question most of us are asking, are we going to bounce back to where we were in January and February? Business was lowering at the end of the year and early in the year. My take on this is most unlikely. We are probably not going to bounce. We are going to have a gradual return to normalcy due to the many factors. There is loss of purchasing power for many of our clients. The dental care will be downgraded on the priority list, on the shopping list of most people because of the issues that we all know. And therefore, we are actually going to find that there will going to be a downgrading. So dentistry will not be a priority on the priority list. There is going to be fear, and even now there's fear of contracting COVID in the dental office. I've seen that from many patients who will not come. Of course, there is the ability and disability of many practices to be able to put into practice the necessary interventions, such as the social distancing and PPEs and that kind of thing. And at this point, sometimes you may need to ask, so what are my suggestions? I would say in business, perception is everything. Perception is everything. Can clients trust that our offices are safe? That's a very big question right now. I can tell you for sure, many patients are going to change their dentists on the account of perception. Because if they perceive that probably our office is not safe from COVID and other things, they will move on to the next person to just check out. So what innovative businesses do during this time and during difficult is to reinvent themselves during difficult times to grow and move to the next level. And I think we don't have any option. I think this is the time to innovate and actually move to the next level. We must have hand washing sinks available at the entrance and even at the reception. We need to have hand sanitizers everywhere in the office. Let's move to the next one. I've said we need to innovate and we need to adapt. And I think this is not just for COVID-19. I think all the time we have to be doing that. This picture was taken, I think, this picture was taken in one of the dental clinics. I won't say where, but the dentist, the dental clinic, it's not a pediatric dentist who owns the practice. So this is just a way of innovating. This is a way for those who are pediatric dentists. I'm sure this picture will catch your attention, that's an attractive pediatric room. I was just putting it there that we need to innovate, we need to adapt to the current situations. Let's go to the next slide. Suggestions continued. We need to have relevant questionnaire, and of course, we need to take temperatures for all the staff and the clients. I suggest that for your staff, you need to take temperatures in the morning, at lunch hour, and in the evening. And then we need to monitor as closely as we can, and we must do the same for the staff. We need to social distance and configure our waiting area receptions and our surgeries so that we can communicate. By the way, I'm just talking about the issue of perception. If people perceive you are not enabling them to social distance in your office, to configure, they will just move on. Your booking, our bookings, our diary, we need to have enough time in between to ensure that we are able to social distance our clients, and we need to have proper disinfections in the surgery in between the procedures. A big question was asked, why is it that most families and businesses went into financial crisis in the month of April, when we only crossed on the 20th or 25th of March? And I think the question there is, there were no plans for the unexpected, not just for dentists, but for most people. Going forward, if you do not get anything from this presentation, this is probably my message, that 5% of the income of our businesses or of your business must go to an emergency fund, period. And you need to facilitate your staff to also do the same. 5% needs to go. Assume that you only earn 80%. Another big question is being asked, should we adjust our fees or should we not? To cover for I've seen that in the dental forums. We need to raise fees to cover for the PPEs and for the many things. My take is that do not raise your fees from a business perspective and a point of view, and do not raise your fees yet. Everyone has to be prepared at this point to take a share of the beating. And us as dentists, we are not an exception. However, if you must, then you need to know what I'm sure somebody had suggested about your billing per hour. I think I've discussed and talked these subjects on several occasions in KDA forums. Your billing per hour, it's one of the most critical points, areas of your practice that helps you to make critical business decisions on pricing, on hiring staff, and all that. I probably may have to do another forum for those who may not have gone through the billing per hour session. I would say if you must raise, do not raise your consultation. It's usually very obvious and people are able to pick your consultation. If you need and you must increase your fees, adjust, and your billing power will help you to adjust in an area that will make the biggest impact. Normally, you want to check the procedure with the highest frequency in your office, because if you raise even a minimum 500, 1,000 shillings on the frequency, on the procedure with the highest frequency, then normally the impact and on the bottom line normally is high. And it is not obvious to everybody that fees have been raised. Overhead reduction is a critical thing. You need to compare prices, as I've said before you order. Please call a few suppliers before you need to negotiate prices. Right now, things are completely negotiable. We know face masks were costing 7,500 shillings as we were closing at the beginning of April. Now we have seen they are coming down 2,000 even for the surgical mask. I would encourage, this is a time for dentists to start ordering in bulk, combining 2 or 3 practices in order to get volume discounts. I think this is a time we need to come together, and that way we'll be able to negotiate. Even from the local suppliers, if 3 of you are combining, then you would be able to get volume discount for buying. Order some supplies from some pharmacies out of town. Okay, probably most people don't know this, but I've done this for the last 10 years. Things like normal saline, surgical spirit, the same bladder that you use in the office. If you order it from Thika, from Nakuru, you discover that it's probably 30% of what you buy here in Nairobi. So those are some of the things that I would say, check for those things that you can from out of town. Involve your staff in identify areas of wastage and how to rectify that. And I would definitely say import some of the supplies for yourself. There's no rocket science involved in this. Last week I was just checking on one of the air purifiers here in Nairobi, and it is costing about 60,000 shillings. And just asking my son to buy from you from the UK, basically at less than half of that price. So you need to start thinking about that. How do we conclude this? I think we must accept that times have changed and we must adapt. As you can see from that picture, I'm sure most of you are already there. You are fully kitted with PPEs and all that. And you know it is not easy, it is not cheap, but do not panic. Just do that which you can at this point, and that you know that you are safe. Okay, let's go to the next one. Things have changed. Okay, I am using the next two pictures to illustrate how things have changed. That was my birthday for 2019, held in a high-end hotel. As you can see in that picture, there is no social distancing, there is no masks. Basically, we are just there and having fun. Fast forward 365 days to April this year for my birthday. There you go, in lockdown, in the village, shelling macadamia nuts. Okay? In fact, and even trying to social distance from my wife. Watch it. That is how things have changed. A parting shot is all life dentistry? I'm saying all life is not dentistry. Okay? This is not the end of the world. Even if things come short to the whatever, there is one dentist who called me 2 weeks ago, and she confided she was actually thinking of quitting dentistry. She doesn't think she can meet all the things that application, and I agree, sometimes there is that. But we need to realize that all life is not dentistry. Let's go to probably the last slide. Let's move on to the next slide. Okay, what am I saying? We must diversify. Okay, we must diversify. When I was raising my two older children now who are young adults, whenever they asked for money, I would tell them, money does not grow on trees. Okay? Now during lockdown, I am teaching my son, my last born son, Victor, who is there in that Victor, that actually money can grow on trees. As you can see, what he's harvesting there is basically, he's harvesting money from the trees on our shamba, on our farm. And therefore, what I'm saying is that we don't have to go to farming, all of us, but we can diversify. Dentistry is not everything. And I think we need to do what we can, but I think we need to rethink, and that if you are not cutting a cavity, if you're not doing a pulpotomy, what else would you be doing? Napoleon Hill says, every adversity, every failure, and every heartache carries with it the seed of an equivalent or greater benefit, depending on how you handle it. My dear friends and my dear colleagues, doctors, this is an adversity which has faced the whole world. And let me tell you, it carries with it the seed of an equivalent or a greater benefit. So take time, relook at your practice, relook at your life, relook at your finances, relook at your everything and reorganize, and chances are that things will or might be even much better than they were before. Thank you. Newega. I would end there because of time, and just probably welcome some questions. The last slide. Yeah. Okay. Dr. Nick, are you there? What is still on us with us?
Yes, yeah, I can see. Yes, probably.
Just will come around.
Okay.
Thank you very much, Dr. Mwangi. We were all really waiting for this presentation, and I think it just made its way with all the things that we had to wait for. I just want to, I didn't get a chance to introduce you properly, even though you thought I did. So
Yes.
I do want to, because I was feeling very privileged to introduce you. You know, you come with so many years of experience, and personally for me, I'm very amazed by the fact that, you know, it's not just dentistry for you. You've gone and studied so many other things, leadership, you've done MBA, and I'm sure this has all helped you in your overall life, but also your practice of dentistry. So
that's true.
Amazing. And I mean, I looked at your CV and the list just goes on and on. So, you know, you're a fellow of the ADI, a fellow of the PFA, a member of American Dental Association. So coming here with a lot of years of experience, I love how you broke down everything that we should be doing in these times of COVID. I think a lot of the attendees will agree with that. We've had throughout the session over 200 people listening to this. So I'm going to go through some of the questions now with you.
Yeah, sure.
Dr. Noah is asking, on remuneration of staff, what have you found that works for dental assistants, front office, other staff in a long-term basis?
I don't know what probably she means, but what I have found useful is that especially for the staff, for the front, especially, let me start with the front office staff. It is important to have well-qualified people at the front office, because they are the reflection. They are the face of your practice. And people who are able to relate with the clients at their own levels. We now know many of the people around who comes to our practices are well educated, they are well traveled, and therefore we need to have people who are probably will be able to communicate with them. And therefore for those, we must remunerate with them well. The other thing I probably have also found out, on top of just paying the salary, I try to look for other innovative ways to encourage the staff, because it's very hard times we live in, especially in the city. Like for the supplies, that some of the things that we sell in the office, mouthwashes, toothbrushes, other stuff, all that kind of things goes into ortho and all that. I reached a point where I said, and I dedicate all that income to the staff. So the mouthwashes and all that and everything. And that means on top of their salary, they just pay for the cost of buying those supplies, but then they share out. And therefore it is in their own interest if they encourage people to take mouthwashes, to take toothbrushes, to take all that kind of thing. So we're looking just for innovative ways to try and, apart from their salaries. I don't know whether Dr. Noah, I have covered your thing, but you also need to have an annual increment for your staff, a fixed annual increment for your staff. But then on top of that, there should be when the practice performs exceptionally well, every 6 months also, you give them a bonus. Around Christmas time, again, at the end of the year, you also give them a bonus. I think that really motivates the staff, and they help increase the productivity of your practice. Thank you. Dr. Purvi, you can unmute.
Yeah.
Okay,
Dr.
thank
Purvi?
you.
Yes.
Sorry.
Yes.
I will not put my mute button back on.
Yes.
The next question, and this is something I think a lot of the attendees will need to know. I know you said we'll do another whole presentation from it, but in a couple of minutes, can you just give us an overview on billing per hour? Thank you.
Billing per hour. Okay, billing per hour. It doesn't mean, when you're in second year, Professor Magoha taught us that that is a benign prostate hypertrophy. Yeah, in business is billing per hour. So billing per hour, what you do is that you need your front office people to track the hours that you work in your office. So if you walk in at 9 a.m. and leave at 3 p.m. So every day on your record book, they need to track each doctor in the office. How many hours did they put in of work when they were in the office, whether they were working or not. So long as they signed in, they walked into the office, whether there were patients or not, those are hours that you have worked because you are supposed to have worked whether you had a patient or not. So every day, the hours are recorded somewhere. And then at the end of the month, the total number of hours there are counted. And then, of course, there's a daily income. There's the income for the whole month for each of the doctors in that particular office. So suppose one particular doctor earned $1 million shillings in that office 1 month. And they worked for 100 hours. So billing per hour is the total income for a particular doctor divided by the number of hours they were present in the office. If you walked out, let's say to go to the mall during the day or something like that for an hour or two, your front office should be able to exclude that because you were not available to see patients. So this person who earned $1 million shillings and they worked 100 hours, you divide that comes to 10,000 shillings per hour. That's their billing per hour. That means for every hour in that month they were in the office, that is what they earned per hour. And then therefore from there are many other formulas and other things that we need to go in to help us to calculate and know how to increase and raise your billing per hour. But the baseline is that the billing per hour is probably the most important business thing in a practice, a dental practice can do. Other professionals cannot be able to do that, but a dentist, the billing per hour is most critical. And you will find that people coming early into practice, their billing per hour might be even 2,000-3,000 shillings. By the time you're practicing for the last 20 years or so, you may find your billing per hour is even 20,000-25,000 shillings per hour. And therefore, that's really, that's not your worth. The billing per hour is not what you are worth. The billing per hour is what your 1 hour is worth for that. And that helps you to know how much to charge for each procedures. For example, if a surgical disinfection, my billing per hour is 20,000, that's high. It's 20,000 per hour, and I need to do a surgical disinfection, which is going to take me 3 hours to do. And I charge the patient 20,000 shillings. That means I basically have reduced my income by a third by doing a procedure of, yet my billing per hour, I should have earned 60,000 shillings for those 3 hours, but now I have earned 20,000 shillings. So should I do that procedure? Not really. I'm not going to do it. I said I refer the patient to the oral surgeon and that kind of thing. Some of the procedures we do are not necessary in the office. You need to let other people do to help increase your billing per hour. Some of the procedures you ignore, the very basic ones who are taught in dental school, fissure sealants, flowable composites, and all that. Those are things that are going to raise your billing per hour. And you teach your dental assistants on billing per hour, and they will actually help you to raise that. Probably I may need a full 1 hour for billing per hour, but that one I'm going to charge.
Thank you. Thank you, Dr. Mwangi. I think that is a very important point because I think over here we are so used to billing per procedure that we
Yes.
forget to look at the time, and time is money after all.
You
And
charge for your time.
Exactly. And the other point I took across from this is, which I find a lot of dentists don't like doing, is referring patients on. When you know that it's not worth your while to do something, then refer it to someone who can do it and who is happy to do it. You know, we should be sharing care. So thank you for that. That was very valuable. The next question I have is, does doing a business course add value to the dental practice?
I would say, I think a level of certificate or diploma in business administration should be taught in every medical and dental school. Because I was talking to my son last night, who is a graduate engineer, and I was asking him, why do you think he saw my presentation, and he was asking me towards the end, he said, yeah, because you doctors, you don't have any transferable skills. That's why you are not, you're not presidents. That's why you're not CEOs. That's why you're not in these other fields. Yet we find engineers. Every other company in the town is being run by engineers, especially mechanical engineers. Why? Because they have a lot of transferable skills, because they do all these other things in their courses. They do business, they do everything. So I would say, and I would recommend, I think, during your own free time, whether it's an online course or it's a part-time course, I think it would add much value. It gives you the courage to make certain decisions that you would otherwise make. And you also get to understand some of the dynamics that are happening in the business world, because you do not practice business and dentistry in an isolated environment. It helps you to understand the whole environment, that what happens in the UK directly affects us. And I would say it really does help to learn a bit of how to invest your money, which are the best ways that you can invest the retro money that we make in the dental practice. I think we do earn quite a bit of money as dentists, but we don't know how to invest it. So by the time we retire, we actually have nothing. In many cases, we have very little, because we don't have the skills to invest. It's probably people take advantage of us. So I would recommend, I think all of us should endeavor to do a basic business, have some business skill. Yeah.
Thank you for that, Dr. Mwangi. I have a comment on that. You said medical professionals, we don't have transferable skills. That's what your son said. I'm not saying
that's what
he
said.
He said.
Yes.
I think medics, we don't realize the transferable skills we have. Okay. We have a lot of transferable skills, but I think the way we are taught in dental school and the way we are made to think, we think that it's the only thing we do. But we can do everything from client management to human resources. There's a lot that we don't realize. And I think it's thinking out of the box. And I agree with you. Doing these courses make us realize that we know a lot more than we do. Talking about investments, I think there was another question earlier on, that how do you make sure that you're getting a passive income, either from your practice or from your investments? What is the advice you have about that?
Okay, on passive investments, what I would say is that, and I mentioned about 5%, that's really very small. That's really a must after COVID, from what we've seen. 5% is not yours, it goes to an emergency fund. And of course, it would help some of the funds to be put in a foreign currency. So I think at this point in where we are practicing, it's a global village. I think every dentist practicing in Nairobi should be having at least a Kenya shilling account, a USD account, and even a pound account. Because we saw from the last 3 months, the Kenya shilling literally went to almost 100 and close to 110. That means if you had kept your money in Kenya shillings account, 10% of your money was wiped off in 2 months. But the person who had kept their money in the USD, they basically gained 10%. So those are some of the things that we need to invest in. I think what are some areas that I have found very helpful from my friends and personal perspective is the money market. In the money market, British American, Britain has got a very good on money market, and you can open a money market account or a wealth management account, and their rates are incredible. Right now, for the wealth management, they are at 11.5%, even during this time. And therefore, you just leave your money there, and you let it. And one of the ways I would, and I have recommended this to a few of my friends, even a few dentists, at the beginning of the year, you say, I want to send this amount of money. I want, let's say 20,000 for those who are younger, 50,000, even those who can afford even 100,000. And then in January, you actually write post-dated checks from January on a particular date of the month, all the way to December, and give them to your investment advisor. And then he just go ahead and banks. Probably he can call you, and he banks those in the money market for you. And before you know it, your money has grown and it has worked for you. I think those are some of the things we need to share, especially for us who have a bit of business skills. I think the money market is because it's stable, because if you fix your money at 11.5% for 6 months, then it will not change, however, and you know exactly what you're going to get. So those are some of the things. Probably for those who can afford a little rental income comes in very, very handy. And I think there are still very many other businesses, passive businesses that we can be able to work on at this point. Thank you.
Thank you very much for that. I am totally on board with you with the money markets. And I like the idea of, just putting post-dated checks. So, it's coming out, that money is going into a fund, into savings. And that's very important. But also the importance of diversification of your investments, so that all your eggs are not in one basket.
That's true.
My next question is from Dr. Ayunda. Is this the right time to open a medical center or dental practice, or should one wait? And he's adding to this, it's a practice which had been planned for before and finances are ready.
Yeah, that's a tough question. But let me tell you, people who are risk averse, it depends on your level of risk averseness. People who are risk averse, this is the time to start the business. People who are a bit not risk averse, are risk conscious, then if you're not a risk taker, then this is not probably the best time to. But for those who are risk takers, most people actually start things during when things are in recession, and when things are tough, especially if funds were there. I practiced in Thika for 12 years, and at the peak of my career, I moved into Nairobi in the middle of the post-election violence of 2008. Okay, and I left the practice in Thika and just came to sit doing nothing in Nairobi. So you can see, you can check my level of risk averseness. So people who really are risk takers, they sometimes thrive when things are, and we are actually trying to do that even during this time, changing things in the office and that kind of things, and making it communicate to the clients that your office, as I said, many patients are going to walk out from many dentists. So don't let your patients walk out on account of perception. So you need to create a perception that your office is good, your office is safe at this time, and you're doing everything possible to protect them. Otherwise, they will all walk out. Because I'm seeing 2 or 3 new patients every day for the last 3 weeks. And what they are communicating is, I am not sure where I've been going. Yeah, that kind of thing. And I hate that. I don't want to ask where they are coming from, but they are coming from somewhere. So ensure that they are not coming from your place to go to Dr. Puvi's office.
They're most welcome in my office. But yes, I must say, Dr. Mwangi, just as an aside, I think your answers and the fact that you took a risk at that time, my husband is sitting here in the background listening, doing his work, and he was like,
Yeah.
wow, it's very inspiring.
Thanks.
The next question I have is from Dr. Silvano Wambugu. Do you have contracts with your locum dentists? How do you motivate them? Do you have contracts with your
Yes.
local dentists? How do you
Yes.
motivate them?
Actually, I don't have locum dentists in my practice. I have associates, and some of them are very long-term associates, and because you know this idea of locum, it's like there's no ownership. The person doesn't seem to own the ideals, the whatever of the business. So I think it's very important to sign contracts so that somebody commits themselves, probably for a minimum of 2 years or 3 years, even if they are coming on a part-time basis, but they have signed a contract. And the terms of engagement, the terms of disengagement are there, and they know which days and which hours they come, so that even the clients get to know Dr. So-and-so works in this practice on this particular day, and they kind of, even the staff get to treat them much better than the previously issue of locum. So I think we need to be moving a little away from a hit and learn situation, where even the younger dentists will be encouraging them to come in and commit themselves to particular practices for a period of time so that they can grow themselves, they get to learn, they even get to build their clientele when they are in those practices, so that if they started and went out, there are some people who completely are attached to them and most likely would like to go and work with them. And then if they come and work in a good practice, chances are that they'll go and set up a practice which almost closely resembles that. And therefore, it's not a hit and run. So I think I would prefer working with long-term associates, signing for contracts, and not people who are just coming in and out on, yeah, that kind of thing. Yeah.
Yes, no, I think that's true, because taking ownership of the practice, I think there's a big difference in someone coming in and out and someone who's there all the time and actually feels part of the family of the practice. It makes a big difference.
Yeah.
What next question from Dorcas Musera? What is a good succession plan for a practice?
Yeah, thank you, Doc. That's the elephant in the room. What happens is that in every field, there is growth in every industry. Among the lawyers, especially in Kenya, I think that's really usually has not been a very big deal because of the partnerships and that kind of thing. But in dentistry, that has been because it's in the past, it has been usually a one-man show, what we call a one-man guitar business. But I think now we have seen most people are going into either partnerships or getting long-term associates who work in the business, and then they slowly increase their percentage of ownership in the business. And I think the owner needs to communicate to them that in my absence, you actually are the one to run this practice. And so be working at buying me out at the point probably, but they need to be growing so that they are able, it's attractive for them to stay. Of course, the other succession thing is if you have children who are dentists, then that, of course, makes things much, much easier. But if you are not lucky like me, you have to go to the other plan.
Thank you, Dr. Mwangi.
Yes.
Someone is asking, and I don't know where this question is coming from, but I guess it's also, I think it's about perception, and I'll see what you say. Are you
Yes.
ever really out of the woods in private practice?
Are we out of the woods?
Are you ever out of the woods? So I guess he's asking, are you ever not struggling? But I think that's what I take from the question, but I think it's a
Okay.
misconception.
I think probably, if I understand, are you ever out of the woods? Is can you make it? Can you make it in private practice? Can you make good money or something? I don't know whether that's really what they really want.
I think
Well,
that's it.
yeah, I think so. There is dentistry is a good practice. Is a good business. Let me tell you, you'll never become very rich as a dentist, but you would be able to be wealthy. And wealth and richness is two different things. Wealth is the contribution you have made to the society. I think we make significant contribution to the society. I think that is wealth, and somebody who has made a good contribution to the society, they are not in the woods. And as you make a good contribution to the society, if you do a good job, and you are consistently honest and have integrity, I think what I've seen is that money just follows. You really don't have to struggle with that. Money will follow where consistency and faithfulness and that kind of thing is concerned. So for those ones who probably might be struggling, I think just hold on there, but try to practice dentistry with integrity so that people can question anything else. Your skill, your competence, people can question that, but let them not question your integrity. That way, they will go away from you because of your skill, but probably they end up coming back because they know that you're a person of integrity. That way, over time, but you cannot really be out of the woods. You don't succeed in dentistry by practicing for 5 years. I think you need to be practiced on the long term to be able to see good results and good growth. Thank you.
Thank you, Dr. Mwangi. Totally agree with you. I've got a question from Dr. George Mwai. Why don't dentists come together to form franchises?
Why don't dentists come together to form franchises? I tend to think, I may be wrong, it is the nature of our work. Our work really locks us in. You go into your dental office, dentistry is energy sapping. It completely saps your mind and your brain. And by the end of the day, when you come out of that office at 5 or 6 o'clock, whatever time, let me tell you, you probably don't have much to be able to think about all those other things. And if you continue like that for years and years, then the issue of forming franchises and that kind of thing does not arise. But what we said before, if we have a good number of dentists who have also done a bit of business, then what we would find is that we would find a critical mass of people who are now able to get others to come together and establish huge dental practices and franchises, which can be spread all over the counties and that kind of thing. So I think that's the other thing. The other thing I would say would be to bring non-dental people into the group. So if you are 2 or 3 of you, you don't have to go and dig everything. Just hire somebody else or ask somebody else to join the practice or the franchise. And that somebody is not a dentist, is a completely different person. It's an engineer or a business something. And then they do all the work and even have a lawyer in the process in the group. And that way then you will find that then they would be able to do all that for you. So you don't have to do everything for yourself.
Perfect, thank you. Dr. Siva Ovi Bingire is saying, thank you for a very great talk. Apart from partnering in bulk purchases that you'd mentioned, what other basic areas can you see where the private clinics can maybe collaborate?
Apart from?
So apart from, buying in bulk, so coming together and buying in bulk, what
Yes.
other areas can private clinics collaborate in?
I think, especially in the area of insurance, I don't have any insurance. I have not signed for any insurance in my practice. But I think that's an area that needs, I don't know what was discussed yesterday in KD, I was not able to join, but that's an area that probably Kenya Dental Association needs to take, and we need to take up. And it's KDA which should be negotiating with the larger Kenya Insurance, Association of Insurance, on things dental. And then from there, it is KDA which recommends that these are the dentists we think are qualified to be included in this panel of whatever. And therefore KDA would be even having a team or of people who are able to even inspect the clinics and establish that they are to the level that they are at par to be able to do that. That way they can be able even to negotiate the prices of all the procedures. So I think KDA needs to play a much bigger role, especially in the insurance industry. And we as individual dentists, we need to let KDA take up that role, the way the American Dental Association has done for them. They lobby all the way to Congress. Like this April, they lobbied on the dentists who were out of business. And they were given money. Congress passed. Dentistry was included there. Part of the money that was released. But that is the KDA so we need to strengthen KDA so that they can lobby for us and be able to do this kind of thing. And that. I think the other thing, as we had said, is that on the area of referrals. I think we need to encourage people to refer as many people as you can out of your office. And then to people who we know, because now we have very many specialists. Let's refer people so that we get better care for our patients. That way we support each other. And then for those people who patients are referred to, please remember to write and thank people who refer people to you. Write back and say, what were the findings? How did you manage that particular patient that I sent to you? And then if I said I referred you this patient to do this, don't do other things. Refer back and let me do what I was supposed to do next. So I'm not fishing patients out of your practice, but you refer the patient to our practice because you know our practice is much, much better in this particular area. And then we are not that kind of, that's a kind of collaboration, I think, so that now we are moving to the next level of maturity in the practice of dentistry in this country.
Thank you. I agree. Referrals are very important. I don't know why a lot of dentists are scared to refer, but I think you brought that point on that sometimes you're scared to refer because you're thinking you'll lose the patient completely. So I think the referral, the person you're referring to, the relationship has to be there. So that's very important. A question, and I bring this up because a lot of dentists are scared not to be on insurance panels. And here, I think they will not survive without insurance. And here you are saying you do not take on any insurances. What made you take that decision, and how have you, and I'm guessing, and looking at your business, it's obviously very viable. So a word of advice to the dentists who are worried that they can't live without insurance patients.
I gave up. In Thika, I had literally all the major insurances on because basically our practice was probably the best practice, that part of Mount Kenya. So the insurance companies didn't have much option but to put us on their board. But it was sometimes pain for me to leave my job and go and queue in an AR office coming all the way from Thika and spend a whole day trying to chase my money. that did not go well with me. And immediately after I did my business degree, that is one of the decisions I had courage to take. That's what business education does. I said, any insurance company who signs in our office, it will be at our terms, not at their terms. And therefore, they do not dictate how much I am to charge. I am the one. So if they want their clients in our office, then they need to pay what we charge. Of course, many of them are not willing to do that. But what happens is that if you build a good name, a good brand, people have no option but to buy the brand, whether they are insurance patients or non-insurance patients. Not that we don't see insurance patients. In fact, we see them every day. But we print the forms for them in our office. They pay cash or whatever means they are paying. We fill, sign, then they go claim. And then they say they get refunded after 2 to 3 weeks, whereas the dentist gets paid after 6 months. So the only other problem is that when insurance tells you how much to charge for a particular procedure, then you have to fit your costs into that fee. What is the end result of that? You end up compromising. That's why I've seen very many people these days are doing grass ionomer fillings. They are not doing, but because they are not able to fit their high-end composites in 4,000 or 5,000 shillings, which the insurance wants to pay you. But if I want to use 3M products in my office, then I know how much I should charge, and therefore the patient is willing to pay. I think that's really the courage we need to take. And what happens is that if people, you have a good brand, you have a good name, people will still come to your office and they will pay, and then they will go and claim. So you don't have to sign to the insurance, every insurance in town, which really, somebody sitting in an office somewhere, they have never gone to see a dentist themselves, and they are telling you how much you should charge for a filling. Nothing. Yeah.
I hope it's food for thought for people who are worried that they can't live without insurance. I think we need to take a page out of your book on courage and risk-taking. I really think we all need to. I think I'm going to do the last I think there's last 5 questions. I'm not going to take any more after that. Dr. Elvis Mutai, and this is quite relevant, especially because he says, how do you ensure, one, career progression and keeping in touch with current trends, and also running a business? How do you manage everything?
I think that's very critical, especially in career progression. You are not going to build your practice if the last time you went to school is when you left dental school. You have to be in school throughout, and every other opportunity that you get, you need to go out for. And I have invested heavily myself on continuous dental education, both locally and even outside. Of course, I completely take advantage of the local ones because I know they are much cheaper, especially during the scientific conferences. I ensure I do the hands-on courses, 2 or 3 of them, because if I was to do that course out of the country, then I have to pay for my air ticket, for my hotel, and that kind of thing. So I take advantage of that local training that is given, that organized by companies, all these companies. I ensure, and some of them do charge quite a bit, but don't hesitate to pay and learn. I think the other thing is just you have to look out for opportunities to go out and train and learn for a week, 2 weeks, or whatever period it means. I have been to many countries for training, for different, whether it's short-term in orthodontics, short-term in whatever. I did 2 years in implantology in Pretoria, and I had to fly into Pretoria every 2 months for a week. So you have to invest. Exactly. I am right now just doing short courses on laser. We just bought one of the most recent razor, Gemini. I think it's probably one of the top razors in the whatever. And just before they closed, we closed for COVID. I was planning to go to Egypt for a week or two in Alexandria and just do a 2-week course on razor. So it's something that you have to. But then you must have some people you are able to leave behind, reliable associates who can stand in and continue the work. They may not be able to work as much as you do, but there is always a compromise. When you come and you put those certificates and those degrees and those papers there, they work magic for you. Yeah.
Thank you. We have a question from Dr. Rosalind Nyambura Kigamwa. When do you think is the best time to retire?
Yes, Dr. Kigamo. Okay, she's my colleague. We've done quite a lot of courses with Kigamo. I think many hands on I've seen Kigamo there. I really commend her and respect her. I think she's one of the first ones to do business administration as well. We did around the same time. Yes. When is the best time to retire? What do you mean by retire? What are you retiring? You are not going to retire. You go retire and sit at that tree? No way. So what you need to be doing is first cutting down on your working hours. So as years go by the time probably you are at our age, you are not working throughout. There are some days of the week you can start by taking a day off, go and play golf or whatever you like to do or something like that, or go up country or something like that. And then you slowly cut down on your working hours. Because if you completely just say, I've retired and I'm not going to the office anymore, I think we know now the troubles that are coming with people who say they've just retired from government. So I think so long as you have strength and so long as your body allows, I think just continue working, but just know yourself, how many hours can I put in? And you need to give guidance to the people in the office, the younger dentists, and that kind of thing. And probably because you are the face of the practice, just showing up and just smiling around at the patients probably might be enough. And then you see 1 or 2 patients and just go away. And that helps give the course. But don't plan to retire too early if you still have the strength. But you can leave dentistry and move to something else, which probably you think is better for you. But we are not talking these days. Let's forget about the issue of retirement.
I agree. There's no word. There's no word like retire. And I think you can move on to other things which are not dentistry related, but I don't think we can ever retire. Dr. Agirem Babazi is saying, you talked about motivation of your front office staff, with the selling of the products and all of that. But how do you motivate and how do you keep your dental assistants motivated?
Oh, sorry. Like that one, they share everything, the whole staff, even the cleaner. The whole office, they share everything, they share all of them. Of course, there are many ways to motivate. Let me tell you, motivation, money is not the main motivator. In fact, money is in business is very low on the priority list of motivating people. If you use money to motivate people, no, they would not. I think one of the most key things in motivating your staff, all of them in the office, is basically like the way you treat them. Do they feel valued? Do they feel you value them as people? That's really the way to motivate them. Dress them well. Did you see how those staff at Tender Care are dressed? Okay. Yeah, they feel, the front office, they feel they dress like CEOs. So they don't have to see well-dressed people when they go to Kenya Airways. So that really motivates them because they may not be able to even dress themselves like that when they're coming. But that's an equalizer for all of them. When they come and they really look the same. I have organized courses for them on different things. And every year we do we do a seminar for them, a full day seminar for them, and we invite a speaker on whichever topic and area that we think is of interest to them. And we go out to a good hotel and we spend the day there. And those are the ways to motivate them. Some of them will never go to Selena. Some of them will never go to Pan-Afric. But you're the one who took them there for a full day seminar. Those are some of the things that are non-monetary, but which also help them in their lives. Some of the young people in the office, helping them like learn other skills like driving. Okay, you cannot be you have to be a driver. Almost everybody in the office needs to be a driver. Yeah, quite a number of my dental assistants who have left have gotten jobs, and even caretakers have gotten jobs because I paid driving for them. And even a few watchmen who have stayed long, I paid driving for them. And so that's some of the things. Then if probably money arouse, you can do one big time thing for them that probably they will always ever live to remember. You can actually take them on holiday. It can be a local holiday to Naivasha, to Mombasa for a few days in a week. You can take them out of the country. In 2014, I took my staff of 16 to Dubai for a week. And some of them resigned after 4 months. So, but that doesn't matter. They will ever remember that. That's the only time they ever entered a plane. That's the only time they took a passport. But those are some of the ways that you can actually motivate your staff. Let me tell you, if you are the only person getting rich in that office, you are in big time trouble. As you get rich, the rest of the staff and the rest of the people in that office needs also to be getting rich. Otherwise, you'll be on your own.
Great stuff. I think one of the big things that I've learned is that when you're working, when you have a purpose, your purpose is greater than just you. It should involve the people around you. And that's very important. And that's what you're embodying here. The next question from Dr. Mwangi is, what are your thoughts on dental marketing as a business? I have a fear marketing may look to a client like a dentist is money oriented.
Okay. During my presentation, I said perception is everything. And then still in business, we normally say everything is marketing. You have to market yourself. And the best way to market yourself is to have an excellent product, which also markets itself. But then the other thing is that if you market yourself, you must give what you have promised or what you have marketed yourself to be. Don't put things online, and then when people show up in your office, they completely see a different thing and they get something different. I think market yourself in a way that you actually add a promise, but over-deliver, so that they will actually say, in fact, what we saw online is not even half of what we have seen after we've come to your office. And of course, we know that one of the biggest marketing, whatever, is what we call unpaid for marketing. You being marketed by your own clients. So they do market you. But then sometimes you may also need to thank them for referring a client to your office. We don't do that. In our office, one of the things we ask in the questionnaire is who referred you to our office. Some of them will say through the internet, through what, but some of them will say one of your clients, and then we'll ask, who is this? And we'll normally write a line, an email to thank that person for referring so-and-so to them. A few times you can probably give them a complimentary cleaning or a complimentary something in their next visit or something like that, just to thank them. These are human beings. They're actually working for you. when you're not marketing yourself. So you need to do that. But you have to market yourself, but you have to offer what you have promised and you have marketed yourself.
And I think you've answered, because another question, and I think you've answered it in this, is how do you market without infringing on medical ethics? And I think you have said that by word of mouth, by, thanking your referrers, all of these things, none of it infringes on medical ethics. Do you have any, maybe a couple of comments on that?
Yes, you cannot market yourself as an individual, but as a business. So I cannot put signboards marketing Dr. Mwangi, but Tender Care Dental can market itself. It's an organization. And therefore, if you really want to market, then you need to practice to market the practice, not the individual person that is there. So that's how you don't infringe on all the med. Otherwise, now that cross on advertising actually was removed a few years ago, even by the medical board. So a business can actually market itself, just the way big hospitals, Nairobi Hospital, all that. You can also market yourself, but it's your practice that is your marketing. It is not you yourself and telling people what you are very good at and that kind of thing.
Great. I just want to bring some comments from some of our senior colleagues.
Yes.
I like this comment from Dr. Virgie. Couple of comments. One, he says time management is very important with dentistry and
Yes.
with business. And secondly, I like this. He says he routinely sends a sincere thanks letter for every referral and with a personal note handwritten. So personalizing it, so then you're more likely to get referrals. So I think this is such a great thing. And the other comments I want to give are from Dr. Kubasu. She said, a comment for a young dentist starting out, it is extremely difficult, but, and thank you, Dr. Kubasu, and I'm sure Dr. Mwangi and Dr. Virgie and Dr. Wagayu and all the senior dentists will agree, we are always available to advise you on growing your practice into a business. Just reach out.
Exactly.
Okay? Dentists, dental clinics, sorry, go on, Dr. Mwangi.
Yeah, what probably I would, a rallying call I would make, especially to my colleagues, the senior colleagues in the profession, is that one of the ways I think we need to, as we exit and as we retire, as one of the other dentists said, is, my big question is, how many younger dentists have we mentored before we leave? Who can be able to replicate our quality of work, our ethics, the way we live and that kind of thing. So let's not hesitate to get younger dentists to come and with all their weaknesses and whatever, but we train them. I think let's open our offices for younger people to come in and we mentor them and we train them if we really want the quality of dentistry in the country to go up. But then also to the younger dentists, my appeal is don't go in for it for money. If you start, your starting point is money. How much are you going to pay me? Yet this person you're going to has been practicing for 40 years. They have all the clients, so you're basically just coming to learn. Just go in first and learn. Let money comes in second. And let me tell you, you will grow. That's how you will grow. That's how you'll also build your own practice. If you humble yourself and come under the wings of a much established younger dentist. But let the beginning point not be how much are you going to pay me? Yeah.
Yes, it is. And I think it's about lifelong learning. You've said this again, investing in yourself, that's very important. So being humble and being willing to learn. I'm just going to ask one last quick question before I go to Dr. Kubasu's final comments, which I think are quite relevant. Dr. June is asking that as dentists, we expose ourselves to a lot of diseases like, COVID, hepatitis, TB, all of these things. Should we put that risk factor when we consider this in our practice, in our billing, in how we manage our costs? Because we are looking at our health as well. So what do you have to say for that?
Yeah, I think we should. And but some of these things needs to be done very covertly, that they don't necessarily have to be put at the exception. Because of COVID-19, we are now raising our fees by 30% or something like that. But you as a dental or practitioner, you probably know how much of the overheads have increased because of the measures that you have put in and the risk that you're putting yourselves in. And therefore, that way, you can work from the billing per hour perspective. If let's say your billing per hour was 10,000 shillings per hour, you can say, because of the risk I am going to be taking with these issues, I am raising my billing per hour to 12, 13, 14,000 shillings per hour. And then from there, you can be able to work backwards and check in that formula that I gave at the beginning. If I raised, let's say, a particular procedure by this margin, then it looks like then working the same number of hours, then it appears like I am actually going that way. I'm going to increase my billing per hour. So it can actually be done and very covertly, because once you do the maths of the risk and what is your expectation because of the risk you are putting yourself and your staff and the things you've done, PPs and all of that, you can actually be able to factor that. But let it not be, and that's why I say don't raise consultation, because once you raise consultation, people know you are raising consultation because of COVID. So let it be something which you as a business person, you know, will add to the bottom line, but not necessarily, you are not shouting it. But then the other thing is that if you really do your clinic quite well, do a few other things, and money is not a beginning point for your clients. Actually, they are so happy for what you've done for the practice that they don't ask too much about money. And in that case, you can actually be able to raise your fees, and very few of your patients will even question what you're doing. I was very encouraged in April when I called one of my colleagues, my former classmates in dental school, and I asked her, what are you doing? What's happening? And she said, I am spending the month of April completely renovating my office, because I want, when COVID ends, I want it to look brand new. I know she's definitely going to raise her fees. She doesn't have to tell anybody. Yeah, and the patients will pay happy. Thank you.
I really like that point that you've put across, because I think a lot of dentists worry about raising their fees or putting up their pricing. They think that they'll lose clients. But the point you put across, that for clients, it's, you know, you think that the money aspect is important, how much they're paying, but it isn't. When you actually talk to them and listen to what they want and find out what they want, and you actually make them feel that they're in a good place to be treated, they will pay. Exactly. You know, so, and I think that's an important thing. In fact, I think, Dr. Mwangi, we need a full day of training with you. We need to organize a full day of all of this training, because I can see so much coming across. So maybe when we are all able to meet, that's something we shall do as KAPD.
My billing per hour will be 50,000 per hour for that day.
We will figure it out.
So we'll work it backwards.
No problem. I like that. The last few comments from Dr. Kubasu. She says, dentists and dental clinics need to start restructuring to business entities. Dentists like doing everything at the office. The dentist is the technician, mtu wa mkono, so and so. But we think we have to do everything to attract many clients to keep working. However, we need to diversify. We need administrators, we need accountants, we need financial analysts for business growth. And I totally agree. I think dentistry is more than just our clinical skills. Dentistry is a business.
I support Dr. Kubasu. Yeah, my front office, two staff, one of them is a graduate of commerce and the other one has an MBA. So there are many decisions there. They'll be able to do a lot more than I can do. So I don't have to scratch things of HR, knowing what does the rebalance mean and all that, termination letters, hiring letters and all that. They should be able to do all that for us. But then you need to hire qualified people, but then you pay them well and move out of their way and let them work.
Thank you, and I totally agree. It's important to have the right staff. And one of the things you highlighted in your presentation, in these times of COVID, if you had staff who weren't performing or who you were thinking of letting go, this is the right time to do it. You know, I like that you said this is the time to restructure, change our thinking, think out of the box. I like the fact that you said your colleague was renovating her clinic in April. These are the things that we should be doing. You know, unfortunately, a lot of us come from a place of fear and a place of being scared. And we need to get out of that. We need to be courageous. We need to take risks. I think this presentation has been amazing, Dr. Mwangi. I know the attendees have gotten a lot out of it. We have had a lot of comments saying thank you. And it's been a great presentation. They've taken away a lot of points from what you've said. So thank you very much for your time.
Thank you very much for moderating so well. And once again, as we end, just a big apology for the earlier hitch. We'll make it better next time. Thank you very much.
Thank you. Dr. June, Dr. Nick, do you have any last words before we end the meeting?
No comments, but thank you, Dr. Mwangi, for a very lovely presentation. We hope that you will grace us again with a second, maybe a part 2 of this presentation in the future.
You're welcome.
All right, thank you.
Thank you.